Thank you. Thank you for the invitation to speak on behalf of the European Public Health Association, which I'm the president of currently, but also in the capacity of someone who has followed up on the development of the European National Cancer Control Programs. A lot has been said already. I would like to stress that WHO started these activities in late 80s. Enhancing and supporting many countries around the globe in developing national cancer control programs. It is important to stress that they are public health programs, and some of the challenges that were mentioned in the previous session should be addressed by NCCPs. In particular, I would stress the mapping of the range of services and activities that need to be delivered in order to meet patient and population needs. Mapping of needs is one of the principles that should be used in designing an NCCP, and I couldn't agree more with the last speaker of the previous session that, of course, in that sense, registries, data, are extremely important. I know that clinicians are not very enthusiastic about data collection and even some of them not even in data analysis. But in the end, eventually, we all would like to see how we perform. We all would like to see outcomes of our work, which means that we have to register what we are doing. The second challenge is, of course, something that has not been mentioned yet today strongly enough, but I'm sure that Joao will pick up on this later as well, is the primary and secondary prevention. Europe's Beating Cancer Plan has laid out very big ambitions in supporting interventions in all four key lifestyle determinants, especially tobacco, alcohol, but also in nutrition and physical activity. Of course, all these activities need to be met and transposed into the national legislation. Alongside with primary prevention that I have just mentioned, you have obviously the challenges of early detection, screening, which is an important contributor to population level outcomes, especially in terms of downstaging and better survival. My own country has been very decisive on screening programs, and we were, for example, able to actually break the curve of incidence for colorectal cancer, which is now in decline because of the massive detection of precancerous lesions which are removed and therefore do not lead to invasive cancer. The next thing I would like to mention, George has already spoken in his presentation about this, are the so-called societal, social, and economic needs of patients. So obviously they are not the ones that are going to be solved by the healthcare system. It's a governmental mission. It's a mission of inter-ministerial collaboration, but it's something we have to envisage. People will finish their treatment. Many will be successfully treated, but unfortunately, some of them will have impairments because of treatment. Some will lose an organ, so their function, then capacity to return fully to normal life will be limited. So rehabilitation and psychosocial support needs to be in place, because otherwise the person is going to end this period, turbulent period of their life with many challenges, so to say. In that sense, of course, I will return back to care and also access in general, access to the different services that fulfill patient and population needs are of course crucial. Cancer is not a disease with small costs, so it is one where societies across Europe have committed important resources, and obviously I agree that we will have to continue doing so, in particular because of the good outcomes. Finally, let me say that, of course, building a national cancer control program is also one of the mechanisms of demonstrating success, because obviously when you have a compilation of advanced targets, data analysis, then in some years later, duration of NCCPs may vary. Usually they are 4 or 5 years, sometimes even 7 years. But you are then able to show the progress. And in spite of many of our critics who say, yes, these programs will give results in 30 years, that's not true anymore. We know it's evident much, much sooner. Within 5 to 10 years, you will see important improvements. Thank you very much.
Thank you very much indeed.